Knock, knock, knock. Hi, Miss Jamie. I'm here to do your head-to-toe assessment. I'm Aya Alabi. Can I have your name, please?
Jamie,
And your date of birth?
7/14/64.
Okay, thank you. Privacy, patient in a comfortable position. I'm going to go ahead and start from your head. If at any time you're uncomfortable, just let me know because I have to do a lot of touching. Is that okay? Do you have any question? Okay, I'm going to start with your head. Your head is normocephalic, sitting on the mid of your body. No macro or microcephaly seen. Can I palpate? Okay. Do you feel any pain? Patient reports no pain, no masses, no lesion, no lumps, no tenderness. Can I go ahead? Your hair is evenly distributed, no evidence of alopecia, and your scalp is clean, no evidence of pediculosis. Pediculosis, neat and flaking or dryness. Can I go ahead and check your face? Your face is oval and all the features are distributed evenly bilaterally. Can you raise your eyebrow? Can you frown? Wrinkle your forehead? Can you smile with teeth? Smile without teeth? Can you puff your cheek? Can you pulse your cheek? Can you whistle? Cranial nerve 7 is intact. I'll go ahead and check your eyebrow and eyelashes. Your eyebrow is evenly distributed. The eyelashes point upward on the upper and downward on the lower. No evidence of exophthalmos or ptosis. No evidence of exudate on the eyelashes. And can I go ahead and check your conjunctiva? Okay, your conjunctiva is pink and moist. No evidence of lesion. Your cornea is dome shaped, shining and transparent. Your sclera is white, no evidence of yellowing and redness, and your iris is round and green in color. So I'm going to go ahead and check your ear. Okay, does this hurt? Let me know if it hurts. Okay, does it hurt?
No.
Does it hurt? Okay, no evidence of tenderness or pain, and there's no evidence of swelling or discharge. And I'll go behind and do the whisper test. Cover your left ear. I scream. Did you hear what I said?
Yeah.
Okay.
I scream.
Okay, patient is able to hear my whisper. Cranial nerve 8 intact. I'm going to go ahead and do the otoscopic examination. I'm going to manipulate your hair up and back to expose the hair. And as I go in slowly, I see no evidence of swelling, perforation, or discharge. I see the humbo and the tympanic membrane. The tympanic membrane is palely gray and shiny and translucent. The contour is slightly concave, and the cone of light is at 5 o'clock. I'm going to go ahead and do your corneal light reflex. I'm going to shine the light into your eyes from 12 to 15 inches. Okay, the light falls equally on both eyes. I don't need to do cover on cover test. Cranial nerve 5 and 7 is intact, and I'm going to go ahead. Can you stare at the wall? As patients stare at the wall, I can see that the pupil dilate to accommodate visual distance. I'm going to bring the pen closer to your nose. Okay, patient's eye converge on the pen as it gets to the nose, and the pupil constrict. The pupil are round, equal, and react to light and accommodation. I'm going to go ahead and check your pupil consensual and brisk to light. Okay, I can see that your pupil on the right is went briskly to light, and the left is consensual to light. Okay, so I don't need to do the cover and uncover test. All right, so I'm going to go ahead and do this 6 cardinal gaze of light. you fix your eye on the pen. 1, 2, and 3. Okay, patient's eye move equally bilaterally with the pen, no evidence of nystagma. Cranial left 3, 4, 5, and 6 is intact. I'm going to go ahead and do your nose. Okay, your nose sits at the middle of your face, no evidence of deviation of septum, and no discharge. I'll go ahead and palpate. Does this hurt?
No.
Okay, patient reports no tenderness, no pain, no lumps, no lesion. Can you close one nail and breathe? Close the other nail and breathe. Patient's nose is patent and can breathe comfortably. Can you go ahead? I'm going to check into your nose and check the oral nasal mucosa. Can you lift up your hand? Okay. So I see that the septum is in the midpoint, no perforation, no redness, no discharge, no lumps. All right. Can you go? I'm going to go ahead and check your mouth. Your mouth is pink and moist, no evidence of anemia, cracking, and lesion at the veniminum border. Can you open your mouth, please? Okay. I can see the oral mucosa is pink and moist. Tonsil is 0, not present, and the uvula. Can you say ha? As patient says ha, I can see the uvula rise and retract. Cranial nerve 8 is intact. Cranial nerve 8 is intact. So I'll go ahead and do your run for the tongue. Can you stick out your tongue? Can you lift it to the ceiling, down to your chin, side and side? Cranial nerve 12 is intact. So I'm going to go ahead and do your neck, range of motion of your neck. So can you extend your neck? Can you flex your neck? Can you move lateral? And can you rotate? Patient has full range of motion on the neck. Can you shrug your shoulder against my hand? Can you move into resistance? Okay, patient has good resistance, good cerebral function. And I'm going to go ahead and check your upper extremities. Your nail bed, there's no cracking, there's no wound, there's no redness. It blanches at pressure and capillary refill 2 seconds. Can you do this? The diamond window, can I see? Okay, the angle at the nail bed is less than 160. Can I have your hand, please? Can I check your elasticity? Your skin retracts briskly back to its position. It has elasticity. Can you pull against me? Push against me? Flex your elbow, extend your elbow. Can you tap your fingers? Can you close your eyes and use your hand to rapidly touch your nose? Okay. Can you open your eyes and touch my finger with your nose? Okay. Okay. Can you make a box with your hand? Close the box with your hand. Open the box with your hand. Throw open the box with your hand. Can you make a box with your finger? Close the box with your finger. Open the box with your finger. Throw open the box with your finger. Patient's range of motion on the hand elbow and the fingers are equal bilaterally. Can you and the strength is 5/5 bilaterally. So can you tap your hand rapidly? Okay, patient proprioception and cerebral function are equal. I'm going to go ahead and do your posterior thoracic examination assessment. I'm going to start at the apex. Patient's shoulder girdle is straight, perpendicular to the spine and parallel to the hips. The skin is intact, no evidence of lesions, scars, no evidence of skin problem. I'm going to start at the apex. Hear the bronchial sound, second intercostal space, bronchiovesicular sound, fourth intercostal space, bronchiovesicular sound, sixth intercostal space, bronchiovesicular sound, eighth intercostal space, vesicular sound. no adventitious sound heard. Can you raise up your hand? Thank you. And breathe as I do this. I'm going to check 4 points on the right and 3 points on the left for any abnormal sound. I can hear no crackles, no wheezing, no ronchi, no friction roll. Thank you. I'm going to inspect your anterior thorax. I can see that patient is breathing comfortably. She's not using any extra muscle, no intercostal retraction. I'm going to start from the apex and check broncho sound, second intercostal space, bronchovesicular, fourth, bronchovesicular, sixth, bronchovesicular, eighth, vesicular sound. The sound at the base is loud, is dull compared to the sound at the middle. No pulsation, and no venous hum. I'm going to go ahead and check your PMI at the 5th intercostal space. No ifs, no trill. And I'm going to go ahead and check your cardiac sound at the 2nd intercostal space. Right sternal border, S2 is louder. At the aortic valve at the 2nd intercostal space, left sternal border, S2 is louder. S2 is louder than S1. At the 3rd intercostal space, F point, no murmurs. At the 4th intercostal space, tricuspid, S1 is louder. At the 5th intercostal space, mid clavicular line, S1 is louder. And I'm going to go ahead and use the bell to check for any abnormalities, S3 and S4. At the aortic valve, no S3 sound, no S3 after S2. At the pulmonic, no S3 after S2. S2 is louder. At the F point, systolic, no systolic, diastolic, and holistic murmurs, no audible murmurs. At the 4th pulmonic, no S4 before S1. At the 5th mitral, no S4 before S1. S1 is louder. So can you please lie down? Thank you. I'm going to go ahead and inspect your abdomen. Your abdomen, the contour is flat. No evidence of lump or or masses. The skin is inconsistent with the rest of the body, and I'm going to go ahead and occultate. Listen to your sound at the right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. No borborygmi, hyperactive or hypoactive sound. The sound is normal active, tingling and goggling 5 to 30 seconds. I'm going to palpate lightly, ½ inch. Tell me if you have any tenderness, any pain, any tenderness, any tenderness. Patient has no tenderness, no pain, no evidence of masses or lumps. I'm going to go ahead and do a little bit deeper, 2 centimeters. Does this hurt?
No.
Does it hurt?
No.
No evidence of masses or lesion, no evidence of lumps. Patient feels no tenderness. I'm going ahead to check your toe. The skin is same as the rest of the body. No evidence of angiomas, angiomas of varicose vein I'm going to go ahead. The nails, the nail bed is clean, no cracking, no redness. It blanches under pressure and capillary refill is 2 seconds. I'm checking the pulsation. Dorsalis pedis present 2+. The tibia posterior tibia, present, 2 plus. I'm checking the chin for pitting edema, no pitting edema. Please can you stand up? Thank you. So I'm going to check your fine motor function and cerebral function. Can you tap your leg, tap, tap, tap? Make figure of 8. Can you run your leg on the chin? Okay. Patient has good cerebral function. And can you stand up? Can you bend over? Okay. I can see your shoulder girdle are straight. Patient has no sclerosis. Can you stand up? Patient has no kyphosis or lordosis. Can you walk across the room and walk back? Toe to, okay. Can you walk back toe to heel? Okay. Can you stand over here with your hands and let the rumble test? 1, 2, 3, 4, 5. Okay. Patient is able to stand 5 seconds without tilting. Can you hop on one leg? Okay, that's okay. And can you, that's it. Okay, can you have your seat? So I think I forgot to do the fine motor for the fingers. Can you tap your fingers? Can you? All right, your cerebral function is good. What else? All right, so I think I'm done. Right? I think I'm done. I'll let the doctor know I'll let the doctor know, and I'll give you your call light, gather all my things, and wash, trash the dirt, open the curtain, put patient in comfortable position, lower the bed. Thank you for allowing me to do your assessment. Thank you. Bye.